Hello, how you going, Kelly?
Good, thank you.
Good, I'm Stacey.
Hi, Stacey.
Lovely. And this is?
Candy.
Candy. Yes, somebody's here for a dental check, eh?
Yes, please.
Excellent. Have you noticed any sort of salivation or chewing funny?
A little bit of extra saliva than normal,
Yeah.
which is what prompted me to get it checked.
Absolutely. Let's have a look. We're going to have a look at your teeth now, miss. Good girl. So she does have what we call a little bit of a undershot jaw. So let's have a look. Good girl. So when we have a look, we see that the lower jaw is just a little bit longer than the top jaw, and that is just her breed. Not anything else. It does mean, however, that some of those incisors down the bottom can be a little bit more prone to dental disease because they don't meet together. They're all apart. But we'll keep looking. Hey, let's have a look down there. Lovely. It's a little bit of tartar and plaque just at the back, and it's a little bit of the yellowness that we can see there, and then some gingivitis just at the very, very back too. And let's have a look at the other side, miss. And similar on the other side, a little bit of tartar, but nothing too bad there. So at the moment, what we'd recommend is going more towards your dental maintenance rather than actually coming in and getting a dental done.
Okay.
And do you know anything about dental maintenance at all?
Not really, no.
Cool. So it basically works around 2 or 3 options. The first is we need brushing. We need mechanical action. Have you ever tried to brush your teeth before?
No.
Okay, cool. So I've got some handouts for you, but basically it's all about just slow and sneaky and doing it when she's a bit conducive and relaxed. You can start with your finger. You don't need you don't need a toothbrush as such. You don't need toothpaste, really. You can start with your finger and some water.
Okay.
And you just want to literally, you're going to show your mum? Yes. This way. So literally we're starting with the finger just underneath the gum. You don't need to lift it up, and we're just rubbing backwards and forwards. And you're feeling the tooth there. You can use water, as I said. You can use doggy toothpaste. You don't want to use human toothpaste though. It's got fluoride in it. We can rinse and spit it. Dogs can't do that. So we do that one. The next sort of step is that you can use a little bit of a pantyhose on the end of your finger. It's a bit scratchy, so the cheaper ones are a bit better than the expensive silky ones, and it just is a bit more abrasive. And then you can work your way up to a toothbrush if you like, but really doing the other things is absolutely fine too.
Great.
What you can do, if you speak to a veterinary dentist, they say once a day because your plaque and your tartar hardens. Your plaque, which is the soft fuzzy feeling of your teeth, hardens within 24 hours. And becomes tartar. So ideally every day, but everyone has a little bit of a life. So once a week is your aim. And then we can actually brush her teeth by making her brush them with using something like dental biscuits. So Royal Canin, Hills, they all have dental foods out there, and they're really good. They're bigger, so it forces her to chew, but they also cut the tooth while she chews them, so they brush the tooth and then break apart. So they're awesome in that respect. And then finally, they have an edible mouthwash in them, so they're going to reduce the bacterial load of your mouth. And the bacteria is what makes dental disease. And then the very, very last thing that we can choose is something to chew on. And something to chew on is like a dental treat. So there's really 3 options when you sort of look through everything. You've got your dentist sticks, which are at the supermarket. They're quite soft, so they're almost like having an edible mouthwash. They don't really brush stuff off teeth for you. You've got your greenies, which you've probably heard about. They don't have an edible mouthwash, but they are brush, so they're firmish, they brush teeth. And then you've got these lovely things called Oravet. They have both. So they've got your edible mouthwash and your brushing action from chewing, and they're really good.
And how often should she have those?
Ideally once a day, those ones. But once again, if every two days, something like that, do what works for you and what works for her and stuff like that.
And is there anything I should avoid for her?
Not really. So there's a couple of things that when you go into your pet shops, you might see that there's things like your Aquadent. So Aquadent is safe if you use it to directions, but it does contain a xylitol in it, which is an artificial sweetener, which can be toxic if you happen to overdose or something like that. So I tend to avoid those. And as far as avoiding, people ask questions about bones and raw bones, what do we do, what we don't do. They're awesome for teeth because they're hard. They're bad for teeth because they're hard. So being hard, they can actually fracture teeth, break them apart, and that causes more dental disease, causes more pain. They are hard, so they do chip off that plaque and tartar that you have there. If you've got a sensitive tummy dog, I wouldn't recommend using it.
Okay.
And then also, if we are a bit of a gulper, we can actually get foreign bodies, which are bones, and you can get shards coming out the back end, which can freak out. That's not so happy to pass. So yeah, it's definitely up to you, and the handouts that we'll give you have all the pros and cons written down as well. But yeah, there are some cons.
Okay.